One Okta research fellow is optimistic that COVID-19 in the Philippines could be considered endemic as early as summer next year. We have Infectious Diseases Expert Dr. Rontgene Solante joining us over the phone to share his insights. Good afternoon, Dr. Solante. Welcome back. First off, do you think that COVID could be considered endemic in the next few months, vis-a-vis the emergence of a new variant of concern, which is Omicron?
Yes, sure. No, there's a possibility that it can be endemic, especially now with vaccination rate is going full blast, and there'll just be pockets of infections that are not a concern. But still, we want to believe that without a new variant of concern, which might change the game in terms of the current vaccine efficacy, then I hope it will not happen. But again, that's just one of the possible scenarios. But hopefully, it will be like that, and every one of us should be vaccinated.
Right. Dr. Solante, can you tell us, for the benefit of our viewers, the difference between COVID-19, being a pandemic and it being endemic or being considered endemic? What are the factors that we should be able to take off or consider?
Well, number one, if the vaccination rate will not be 100%, and there are still people who may be vulnerable to it, then they can still have the infection, but only less numbers. So that's why it can be endemic, not involving significant number of the population. Number two, if we continue to practice also health protocol and lessen the transmission, then that can also help in terms of immunity and protecting ourselves. And number three, I think what's crucial here, Sean, is the booster doses, because we know that post-vaccines effectiveness waned after 6 months. So after 6 months of this booster dose, what will happen? Will we have emergence of new cases because of a waning protection? And that's why we need to, again, give another dose for us to maintain the low level of cases.
Right. Let's step back a little bit, Dr. Solante. We know that, health experts around the world, not just here in the Philippines, are saying that for it to become endemic, we have to treat the world as a whole, or the entire planet basically as a whole, and all, human beings in it. Having said that, Doc, can we say that, COVID is endemic in the Philippines, but it's not yet perhaps endemic, or cannot be considered endemic in other parts of the world? Or should this whole thing be, as one, as an entire planet altogether?
It should be a global equity of vaccine. So everyone should be receiving vaccine, whether you're in a low-income country or in a middle-income country, because one country that will not have 100% protection, people will travel to another country because countries will be opening up, and that's, again, a source of transmission. So everyone should be receiving globally.
Right. Well, let's go back and circle back to what you said, Dr. Solante, about vaccinations. While we are already advancing and doing better with regard to vaccination, there's still a significant number of the population, both here in the Philippines as well as in other developing nations around the world, that have no access yet to vaccines. Having said that, Doc, will this actually cause any delay before we can consider COVID-19 as endemic?
Correct, no, because that's also the other area of the government should also address. It's not just the supply of the vaccine. If we have supplies of the vaccine, but we cannot access, and there will be poor accessibility, especially in the far-flung areas, then that would defeat the purpose of herd immunity. So as much as we have more vaccines, then the government should see to it that this vaccine should be delivered right there in those countries or in those areas, in those provinces where vaccination rate is really low. And I'm talking here outside of Metro Manila, where vaccination rate is still low. And that is really to advocate and, again, engage all of this. Particularly, Sean, there are still vaccine hesitancy around in our population, and I think we need to engage these people that the vaccine is very important.
Right. Well, Dr. Solante also mentioned, of course, booster shots. A lot of us are already, eligible to receive booster shots. And of course, you quite rightly pointed out that a big chunk of the population are still unvaccinated or maybe partially vaccinated by now. Looking forward into the future, do you see that booster shots will become a way of life?
Okay, we need to look at data first. Our concern now is any variant that will mutate to affect vaccines. And so far, Omicron variant, we have vaccines for that. The current vaccine is still effective. What after Omicron variant? That's the scenario that we're looking at. Are there more mutations? Is this a more virulent variant, or is this more resistant to current vaccination? Because if that will be resistant to current vaccination, then we'll go back to number one and give the vaccine that is specific for that variant.
All right, so still a lot of moving parts here. Thank you, as usual, for your time and insights. Dr. Rontgene Solante, Infectious Diseases Expert. Thank you so much for your time, Doc.